My knees were to the point where my life was starting to suffer.
And said it was the worst hip he'd ever seen in his life, and I had no option other than a total hip replacement.
People will take 2+ years sometimes to decide to have their knee done because they think it's not that bad. I can live with this, it's not that bad. And when they have it done and they realize how much pain they were really living with and what an improvement we can make in their lives, they wish that they would have had this done years earlier.
I couldn't offer to babysit my grandson even for an hour. I didn't trust myself to be able to pick him up, to be able to, chase after him if he got away from me.
I sort of faced up to the fact that if I'm going to have an active life, I needed to have the surgery, and the alternative would be to become a vegetable, to sit at home and read and not be active at all, and that wasn't the sort of life I wanted.
I think that the orthopedic program at Memorial Medical Center is so successful because of the quality of the physician staff and the clinical staff that work with the physicians. We are not an assembly line. We take care of our patients one at a time. Everyone is special.
There are many different ways to handle a problem, and we'll start with lifestyle modifications. We'll start with medications. Sometimes we do less invasive techniques that may not involve surgery, but when surgery is necessary, I think it's important to recognize that, and I think it's important to address that on an individual basis.
What may work for one patient may not work very well for another patient. And you have to, when you understand that and you can sort of see what it is that this patient needs, I think it become much more effective.
We have an experienced staff that's very qualified. There's a lot of collaboration going on between them and the physicians and the patients and the family members that you may not get in a bigger facility that you kind of get, just shuffled along in. So I think you can get as good outcomes or better here than anywhere that you choose to go.
I think the successful outcomes that we've had with our patients, with being in the top 8% nationally for medical excellence in orthopedic care, is because of the diligence of our surgical team and the diligence of our medical staff.
Everybody that came in contact with me just did everything that they could possibly do to make me feel comfortable, to help me with my healing process.
We live in one of the most beautiful places in the whole country in West Michigan, and it's very sad that they can't get out and enjoy some of the things that they want to get out and enjoy. We have wonderful beaches, and they can get down to the lake shore again where they couldn't get down there and enjoy the water. And that's just really meaningful to all of us, because those are the things in our lives that are special, spending that time with your family and spending that time with your grandchildren and enjoying your life. We want them to see us as their partner in getting better and getting back to their life. They're people that we respect, and we want them to trust us.
The doctors here do an excellent job, and you can get right back on with your life after 6 weeks of physical therapy and get back to doing what you'd like to do.
I've been golfing, been walking, been riding my bike, and as soon as my pool warms up enough, I'll be swimming. And my grandson's coming over tomorrow.